Hello all, welcome to Dental Notes and Mnemonics. Today we are going to discuss about the Ramsay Hunt Syndrome. So let's begin by defining Ramsay Hunt Syndrome. It is also called as Herpes zoster oticus. It occurs when the varicella-zoster virus, which causes the chickenpox, reactivates in the geniculate ganglion of the facial nerve. This syndrome was first described by James Ramsay Hunt, who detailed the condition as the combination of vesicular rash and facial paralysis. Talking briefly about the geniculate ganglion, it is a collection of sensory nerve cell bodies located within the facial nerve at the sharp bend or genu in the facial canal of temporal bone. It serves as a relay point for sensory fibers, including taste sensations for anterior two-thirds of the tongue and the general sensation from part of the external ear. Let's talk about the etiology and the pathophysiology of Ramsay Hunt syndrome. Regarding the etiological agents, Ramsay Hunt syndrome, as we have already discussed, is caused by a reactivation of varicella-zoster virus, the same virus responsible for chickenpox. After the initial chickenpox infection, varicella-zoster virus remains dormant in sensory ganglia such as geniculate ganglia of the facial nerve. Reactivation occurs when the immune status decreases. It may be due to aging. It is common in the individuals over 60 years of age. Immunosuppressions in the diseases like HIV, cancer, or after the organ transplants. In stress and the other triggers like trauma may lead to reactivation of varicella-zoster virus. Once reactivated, the virus causes the inflammation and the edema in the geniculate ganglion, along with the disruption of facial nerve, motor, and sensory components. Also, the infection spreads to the nearby cranial nerves, particularly the vestibulo-cochlear nerve, which is the 8th cranial nerve. Due to the close anatomical relationship between the facial and vestibulo-cochlear nerve in the internal auditory canal. The clinical features of Ramsay Hunt syndrome revolve around two main symptoms: a painful vesicular rash and facial paralysis on the affected side. Patients often experience additional symptoms such as hearing loss, tinnitus, or vertigo due to involvement of 8th nerve. Loss of taste in the front two-thirds of the tongue and dryness of the mouth and eyes are also common. You can remember the key features using the mnemonic FACES, which stands for facial paralysis, oral vesicles, cochlear symptoms, eye dryness, and systemic pain. Now coming to the diagnosis part of the syndrome, then the diagnosis begins with a clinical examination only. The presence of vesicular rash in the ear canal or the oral cavity along with the facial paralysis is usually enough for the diagnosis. However, additional tests like PCR can confirm the presence of varicella-zoster virus. Imaging such as MRI can also help to detect the nerve involvement. It's essential to distinguish Ramsay Hunt syndrome from the other conditions like Bell's palsy, which lacks the characteristic rash. Treatment for Ramsay Hunt syndrome focuses on antiviral therapy and corticosteroids. Antiviral drugs like acyclovir help to control the viral infection, while the corticosteroids like prednisolone reduces the inflammation. Supportive care is also vital. This includes the management of artificial tears for dry eyes and medications to relieve vertigo. Timely treatment, ideally within 72 hours of symptom onset, can significantly improve the outcomes. If untreated or if the treatment is delayed, Ramsay Hunt syndrome can lead to serious complications. Permanent facial weakness or paralysis is a significant concern. Chronic nerve pain, called the post-herpetic neuralgia, can persist for months. In some cases, patient may experience irreversible hearing loss, especially in the vestibulo-cochlear nerve is involved. Regarding the prognosis for Ramsay Hunt syndrome, the prognosis depends on how quickly the treatment begins. Early antiviral and corticosteroid therapy within 72 hours can result in complete recovery for most of the patients. However, older age, severe symptoms, or delayed treatments are associated with poorer outcomes, including permanent nerve damage. Of this syndrome involves vaccination and boosting the immunity. The herpes-zoster vaccine is recommended for adults over 50 to prevent reactivation of varicella-zoster virus. Additionally, maintaining a healthy lifestyle can reduce the risk of viral activation. In the patient with active Ramsay Hunt syndrome, dental management is tailored to prioritize comfort and safety. Elective treatments like cleaning or filling should be postponed until the vesicular lesions heal and acute symptoms subside to avoid infections, risk, and discomfort. For emergency treatments such as managing pain or infection, local anesthetic must be used cautiously considering potential nerve sensitivity. Strict infection control protocols are essential to prevent varicella-zoster virus transmission. Ensure patient comfort by reducing stress, limiting chairside time, and avoiding invasive procedures unless absolutely necessary. Let's explore the key differences between the Ramsay Hunt syndrome and Bell's palsy, as these both conditions cause the facial nerve paralysis, but with distinct causes, symptoms, and treatments. If we talk about the cause, Ramsay Hunt syndrome is primarily caused by reactivation of varicella-zoster, and the virus attacks the facial nerve, often along with a painful rash. In contrast, Bell's palsy is a condition where the facial nerve becomes paralyzed without a known cause, making it idiopathic in nature. Both the conditions affect the facial nerve, leading to weakness and paralysis of facial muscles. However, in Ramsay Hunt syndrome, this paralysis often comes with a rash of the vesicle near the ear, mouth, or even the tongue. On the other hand, Bell's palsy typically does not present with a rash and it is purely characterized by facial paralysis. Ramsay Hunt syndrome can cause additional symptoms like ear pain, hearing loss, tinnitus, and even vertigo due to involvement of nearby structures. In Bell's palsy, there is often a mild discomfort around the jaw or ear, but more severe symptoms like ear pain or hearing loss are absent. Recovery for Ramsay Hunt syndrome can be slower and more complex due to damage to the nerve and the involvement of the virus. In Bell's palsy, the majority of patients experience spontaneous recovery within 3 to 6 months, with the many regaining full facial function. If we talk about the treatment for Ramsay Hunt syndrome, antiviral medications like acyclovir are often used along with the corticosteroid to manage the inflammation. Pain relief is crucial as well. In contrast, Bell's palsy is typically treated with corticosteroids alone, such as prednisone, and sometimes antiviral drugs are used if the viral cause is suspected. The facial weakness in Ramsay Hunt syndrome tends to be more severe and it often involves other cranial nerve, while in Bell's palsy, however, typically affects only facial nerve and causes a unilateral facial weakness. Regarding the prevalence of Ramsay Hunt syndrome, then it is much less common than Bell's palsy. It accounts for only 5% of facial nerve paralysis cases, while the Bell's palsy is the leading cause, making up to 60 to 75% of the cases. Thank you for watching this video on Ramsay Hunt syndrome and its management. I hope you found this information helpful. If you have any questions or need further clarification, feel free to leave a comment below. Don't forget to like, share, or subscribe for more content on dental health. So see you in the next video. Till then, bye bye, take care, have a nice day.